Dr. Strebl, good to see you. Thanks for
Thank you.
joining me on this.
Thank you. It's nice to be here.
Yesterday, Monday, we taped this. The president had a presser with Bobby Kennedy Jr. Now, when you start talking about science and Bobby Kennedy, well, that's a whole nother episode. All right. Everything from 5Gs to wind turbines cause cancer, all these sorts of things. But this is deadly serious. This is advice being given by Secretary Kennedy and President Trump to pregnant women about the use of acetaminophen, is how it's pronounced. There was some difficulty in that yesterday. But your profession, and you're the president-elect of Oklahoma State Medical Association, you know what was said yesterday. The message to women in particular, when the president said, don't take Tylenol, don't take Tylenol. But it's my understanding is there's science behind why women take Tylenol during pregnancy. Help us understand what they said and why you think that the other side needs to be talked about.
Thank you for the opportunity. So when we try to link certain conditions to certain environmental factors, to medications, to anything else, a link is just a possibility. It is not causation. Acetaminophen or Tylenol is a very commonly used drug in pregnancy and has been for decades. There are very few things that pregnant women are able to use for pain or fever. We know that if we don't treat fever in pregnancy, it can lead to miscarriage. It can lead to physical abnormalities in children, mental abnormalities in children. It's a real danger. And it's the only medication that we can use as a fever reducer in pregnancy. So no one advocates using more medicine than what you need, but when the benefit does outweigh the risk, we as obstetricians recommend that you use medication. Untreated pain leads to depression and anxiety and adverse pregnancy outcomes as well. So in a situation where it's indicated, acetaminophen or Tylenol is an important drug to use. The Society for Maternal Fetal Medicine, which are OBGYN specialists that care for complicated and high-risk pregnancies, said in a statement on September 5th that they believe that acetaminophen use in pregnancy is safe and that the science behind it is safe. When we look at a disease state and we try to figure out what causes it, we try to associate it to multiple different things, and then eventually we may find something that is causal. But at this stage of the game, this potential link is not enough to admonish pregnant women or to keep them from treating themselves when they need to for fever or pain. When you take something that's common, like autism spectrum disorder, and something that is common, like Tylenol use in pregnancy, it's only possible to create a link if we study a large group of patients who have used Tylenol or have been exposed to it and follow their pregnancies and their early childhood development. And we do the same with a group that has not had exposure and follow those pregnancies. It takes years and years of medical research to be able to predict causality. I would say that autism spectrum disorder has certainly increased in the past years, but it may not be that it's actually an increase in the disease, but it's an increase in our diagnostic criteria. The diagnostic criteria have changed, And we recognize that there's a spectrum. We're including more children in that spectrum and more children that are involved in normal situations, normal families, normal schools, not institutions, as a lot of these children might have been sent to live in the decades before. So while I would love for parents and patients that have severe autism spectrum disorder to be able to have the possibility of a treatment, or for us to have a possibility of finding something else that patients can use that might be safer, those are great opportunities, but it is incredibly premature to tell pregnant women to stop using Tylenol to treat their pain and fever.
Yesterday, after the press conference, the FDA walked back much of what was said in there. Now, let me ask you why. What in the world, or why in the world, would the president bring the Secretary Kennedy, into a press conference and infer that Tylenol causes autism?
So there have been some medical studies that have introduced the possibility of a link between Tylenol use in pregnancy and autism spectrum disorder. It's only a possibility. A link is not causality. And we are not there yet. So I think it's premature to apply science where the science doesn't exist. Science isn't political, it's science. And we don't have enough data yet to make the statements that were made yesterday.
The dangers to women, you've alluded to this, but for women that would listen to the president, listen to Secretary Kennedy, and tell their physician if they've got a fever, no, don't use Tylenol. What's the danger there to moms and babies?
So untreated fever in pregnancy can lead to a variety of adverse pregnancy outcomes. It can cause miscarriage. It can cause mental delay in their children. Matter of fact, I lived abroad in college as a student, and I lived with a family who the mother had high fever in pregnancy, and it was never treated. And her child was born with an encephalitis, which is an infection in the brain that made him never develop beyond 3 years of age. So that child will forever be a toddler. And these are true stories, and there are very real impacts or implications medically and scientifically if moms are not able to treat their fever in pregnancy.
So what you're saying is there's no scientific evidence that Tylenol causes autism, but there is scientific evidence that not using it in the right situation does cause harm to babies.
There is definite scientific evidence that untreated fever, untreated pain has negative pregnancy outcomes for both moms and babies. At this stage, there is no scientific data to say that acetaminophen or Tylenol use causes autism. It's too premature to say that.
Last question. There are a lot of people who admire the president, who admire Bob Kennedy, and latch on to some of these theories / conspiracies, whatever you want to call them. If you are a pregnant woman and you're seeing this sort of stuff, and this raises questions in your mind, what's the best path forward to resolving these issues in a person's mind?
Talk to your physician. Talk to the person who's caring for you for pregnancy, because doctors and nurses and midwives are scientists. We are going to follow the science, and we are going to do that because we want healthy moms and healthy babies. So please talk to your provider, talk to your physician, and get the scientific information.
Dr. Julie Strebl, the president-elect of Oklahoma State Medical Association, thank you for your time today.
Thank you. I appreciate your time.